organ. And even when you do the treatment, when the doctor do the surgery, you could end up with more complications based on that surgery. Because when they do the bypass, it now put the patient at risk for problems in the blood that remains in blood that was not detoxified because it bypassed the liver. That's what you need to know. That's what you need to know as a nurse. Last day, we talk about portal hypertension, right? That's where everything started from. Is that so?
Yes.
And we said portal is related to what? What's a portal about?
It's a
Vessels.
It's a
Blood vessels.
From your
It is a blood vessel. And what does this blood vessel, or the role this blood vessel play in relationship to your
carry blood
liver?
to the liver. It's carry blood to the liver.
What's the relationship of the portal? Portal what, by the way?
Portal
Hypertension.
Portal vein. What relationship we talking with the vein? What is the relationship with that portal vein to your liver?
It's carry blood to the liver. The portal vein carry blood from
Say
the
again?
stomach to the liver.
Go.
Mr. West, you don't feel cold in there?
Me?
Yeah.
No, because I got so much layers under my shirt.
It is.
So why you guys didn't say something? If it's freezing, say something, let's see what can be done.
Is a ghost?
Let's see if it will go up. If not, then we will just close off glasses. Because it's not your fault that this place is the way it is. Ownership has to provide heat. You pay for this training. That's how it is. Okay. All right. Portal. Portal vein. Come on, guys. I'm still waiting.
Oh, it connects from, I think, the liver to the stomach.
Yes, to the liver.
It's
From
a,
the liver.
No,
the liver to the stomach.
it's carry blood from the stomach to the liver.
Connects it.
No, it's carry blood.
Blood from the
Liver and
Stomach to
stomach.
the liver.
from the stomach. Spin it around. It takes blood from
From the vessel.
From the vessel to deliver by the
Stomach.
liver and from the stomach.
From the stomach.
From the stomach.
it goes to the
turn it around.
From the stomach to the
It's
liver.
not to the stomach. It's from the stomach and the intestines.
Yeah.
And when that blood goes from those areas, what's so important about that blood that is coming from those areas? What's important about the blood that's in the portal veins?
It goes to the
For the liver to detox the blood, to send it to the body,
to send the blood to the blood.
all over to the body.
Okay, exactly. So when that blood gets into the portal vein from the GI system, after the absorption, it need to be detoxified. It don't just be sent to the other parts of the body just like that. It has to go to the liver for the detoxification process to take place. But then you can get a problem that causes the liver not to perform that function, or that function can become impaired. What is that?
Cirrhosis,
Cirrhosis of the
and
liver.
then fibrosis,
Infection.
Bacterial infections.
Cirrhosis, yeah.
Nora said cirrhosis.
fibrosis. So fibrosis is the first stage, and cirrhosis.
Right, portal hypertension will occur if certain things happen.
Scarring.
The vein itself, the portal vein itself, can have a blockage.
Yes.
That's
Thrombosis.
the very first thing you guys should think about. Very first place that something could happen is in the portal vein itself.
Yes.
You can get a blockage in there.
Arteriosclerosis.
Right. Then the second thing you're going to move from the vein, because remember the vein is taking blood to the liver. The next place will be the liver. And the liver having what?
The blood.
Problems.
With
The term that you used the other day, scars. Scar tissue because of what? Damage.
arteriosclerosis.
Damage to the liver. Whatever caused that damage, right? It could be different things causing that damage. But the thing that is most what? Most prevalent? What is most prevalent cause of scarring of the tissue?
What goes on? Scarring.
Scarring of the tissue.
What?
Collection of plaque.
What is, all right, what is scarring of the tissue? What's scarring of the liver tissue?
Normal tissue destroyed.
Scarring of the liver tissue is cirrhosis. So now the question is, what causes the cirrhosis? And we said that the cirrhosis is usually caused by alcohol.
Yes. Or smoke.
The most
Is alcohol.
common will be alcohol. Persons who are alcoholics, not the occasional drinker. So you have damage to the tissue that becomes scarred. And because it's scarred now, this tissue can no longer do the functions of detoxifying
The blood.
or even producing the bile. So you have this situation occurs. Now, if you get blockage in the portal vein, or you get the liver have scar tissue, you will have a backup of pressure in your portal vein. And that pressure, backed up pressure, is known as portal hypertension.
Tension.
And portal hypertension now can lead to the complications. So what are the complications that you talk about?
Digestive increase.
Thrombosis.
Complications of portal hypertension.
What are some of the complications of portal hypertension?
Splenomegaly.
No, hemophilia.
Hepatitis.
With the portal hypertension, You're gonna find the persons who get the belly swelling. You're gonna get ascites, right?
This is it, spleen.
We talked about ascites the last day, right? Guys, focus on what you don't know, not what you already know. So, you have ascites, which is accumulation of fluid in there, peritoneal cavity. Then the question we asked last time, what is your role as a nurse? What's your role?
According to what, Mr. West?
What is your role? When I say your role, the nurse's role
In general?
related to the ascites. Think of it. What is your role? What is your nursing role?
No, check the weight,
Check the weight.
the weight, daily weight,
Do the measurement.
and then
You
measure.
do the GART measurement.
Yes.
Help when it comes to what's the surgery they call for that? When they go remove fluids? What is the surgery that they
Lavage.
what for the removal of fluids in the ascites?
Lavage.
Paracentesis. That's why you're all stopping the class. For whatever reason, there's a reason why. Paracentesis. And you got to assist with the paracentesis, right? We also stated at that time that apart from the liver having this problem, it affects other parts of the body. And we indicated it affects the brain, right? What did we say happens to the brain?
Level of consciousness.
Blood, it drains the blood.
What is a condition when it affects the brain? What is the... Is it what?
Hepatic.
Here you go again. Hepatic encephalopathy,
Hepatic encephalopathy.
which is when the patient is having problems doing what? Reasoning,
Reasoning.
can't make decisions, they're confused. And all this happens because of what? The portal hypertension, the cirrhosis of the liver. Let me give you a scenario. Have you most of us see persons who are alcoholics, right?
It's very cold. For sure.
And we're not talking about persons who are occasional drinkers or they call them social drinkers. These persons, when they use the alcohol, they are not nice persons to get along with, right? When they are under the influence of the alcohol. Is that so? And socially, it is unacceptable when you are impaired. Because if you jump into a vehicle and drive the vehicle and the cops pull you over, you'll get charged for DUI, right? Driving under the influence. But it's much more of a bigger problem than that, as you see when we come to do mental health. Because the persons who are alcoholics, they suffer from things such as memory loss. And when they get memory loss, they confabulate. What do you mean by confabulating? is that wherever they can't remember, they make up a story put in there. That's why you find a lot of alcoholics. They tell some tall tales, but some of them actually believe what they're talking because they try to fill in gaps in their memory. So they do this thing called confabulation, make up stuff. The person who drinks alcohol and gets into that, the condition is known as Korsakoff. Look it up. Korsakoff. Korsakoff.
K-O-R. What is it?
It's a disorder of the central nervous system characterized by amnesia.
Thank you. Spell it.
Korsakoff. Korsakoff. It's a disorder. Yes. A disorder of the central nervous system characterized by amnesia, deficit in explicit memory, and confabulation. This is a neurological disorder and is caused by deficiency in vitamin B1, thiamine, in the brain.
Cause. What's the cause?
Usually caused by alcohol abuse.
Here we go. And so a lot of these guys you see who are walking in the streets and persons that you know, persons might even be close to you, family members or what have you, sometimes they make up things called confabulation. And it's nothing to be ashamed of. It's that these persons who have that situation, they need help. Right? They will just keep making stuff up because they cannot remember. It's not that they're trying to just find a lie to tell you. It's just that they cannot remember things. And they confabulate. They make up things to fill in those gaps in their memory. And it's not that they're trying to be bad or be a badass and coming up with all kind of stupid excuses. It's just that they messed up in their brain on the way of assimilating information. And sometimes these persons can go into something called look for pink elephants.
You said pink elephants?
Alcohol, pink elephants.
Seeing pink elephants is a euphemism for drunken hallucination caused by alcoholic hallucinosis or delirium tremens.
Okay. So, pink elephant, euphemism referring to persons who have things such as DTs, delirium tremens. They have the shakes. for the word euphemism, please.
Euphemism. It is the use of a word or phrase to replace another with one that is considered less offensive, blunt, or vulgar than the word or phrase which it replaces.
So if you said, go around tell a person now you're a damn drunkard, you can say, boy, you be seeing pink elephants.
Juice.
You don't think what, Miss Sinclair?
No, the word, maybe I.
If you don't want to say euphemism, you can say this person is sus.
If you don't want to be being like really aggressive in your speech. So the liver can be damaged and cause portal hypertension, hepatic encephalopathy. A lot of stuff can happen. Just remember what caused. In your readings, put it together in what cause. What is the trigger? What's the root cause? And most times, for your state board, it's also most times be related to either alcohol consumption or when you have viral infections or you have damage or blockage to your portal. But we're talking about the encephalopathy that's come about because of the cirrhosis. I want you guys to just remember this, because when we come to do mental health, psychiatry, this is going to pop up. And you've got to be able to make that connection. Okay? So what is the treatment we said the last day that you do? And there's specific treatment. Why do you do the treatment? For the portal hypertension. What is the treatment? You do the bypass, right? And when you do, why you do the bypass? Why do you do the bypass in portal hypertension?
Because
I like how you try to get it going. All right.
you do the bypass.
Why do they do that bypass?
I have the image of the bypass in my head. I can't really, because the blockage, you can't, you have to go around the blockage.
Well, why? No, I understand you say there's a blockage, but why? The question is why? Why they do that bypass? You know all that talk we talk about Pharisees, does it make sense to you guys? Hmm?
They do it because it's blocked.
No.
Because the portal, when it's like the portal increase blood,
Artery to your
and
heart.
no, it's increase blood. And
You can what?
the portal can could increase blood to the liver. That gonna.
You guys didn't read this thing, you know. You guys didn't follow up on this.
Is it tips?
You do tips, yes, but that's it. But why? Why do they do the tips? You don't want to know the tips. That's a surgery. That's they got to do that. That's a doctor's. You don't care what they. But why they do it and what is the effect? Because remember they talk about that negative effect. They spoke about the negative effect of the tips. Come on, guys. They spoke about that negative effect. But I want to know why they do the tips. Why do they do the tips? What's the rationale? What's the purpose? Do they do tips because the person had the cirrhosis of the liver? That's what you're going to go with, right? No. When the person have portal hypertension, what's the biggest problem that they have?
The liver, the function.
The biggest problem they have is these viruses, the varicosities, the esophageal viruses, the bleeding. Remember we talked about the bleeding? All right, hemorrhage. You get to do it all over, in the throat, in the stomach, in your butt, with the hemorrhoids. Hemorrhoids is not just from straining. You can get it from portal hypertension. And the big problem with these viruses is that they're easily ruptured because they're under pressure, right? And if they rupture, they're going to what? Bleed, and bleed a lot. And we spoke about, you're going to find the stool to have what color?
Paris brown. Paris.
And then we said that the stool is black. What makes it black?
It's
It's a GI bleed.
it's went through different stages of
No, it's GI bleed. It's upper bleed. Upper GI bleed.
the upper GI bleed.
It's an upper GI bleed, right? That resulting in it being that color.
Drain from the stomach.
And then what we say you can do, what can they do? What can you do, or what can anybody do? If a person has a bleeding varices, let's say esophageal what? Esophageal varices. I love it when you guys do this. Esophageal, look up esophageal varices, please.
Esophageal viruses.
All it means is enlarged veins. What's all it mean?
Very good.
Enlarged veins.
Liver abscess.
So, you guys esophageal viruses? First person, please.
Huh?
What's esophageal viruses?
Esophageal viruses are enlarged veins in the esophagus. They often due to obstructed blood flow through the portal vein.
There you go.
Which carries blood from the intestine, pancreas, and spleen to the liver. Esophageal varices are abnormal enlarged vein in the tube that connects the throat and stomach.
Look at an image of esophageal varices.
You're not good.
Huh?
You're not good.
Uh-uh.
I feel my foot is cold.
See an image of the esophageal varices?
Yes.
And what did Sandra just read? What did she say causes esophageal varices?
Obstruction of the portal vein.
Obstruction of the portal vein, right? Something in the portal vein. And what did she say about the portal vein? It carries what? Blood from the intestine, pancreas, all from the GI system, right? But before it go any other part of the body, the nutrients that's been taken up, it gotta go up to the liver first. And the liver what? Detoxify, and then send it on out to the heart, so the heart could send it all around the body. I got a question for you, before we come back to esophageal varices. What vein takes the blood out from the liver? The portal brings it to the liver. What takes it away from the liver now? Tree.
Remember. Oh Lord.
You're hepatic. Guys, remember, go look for hepatic vein, please.
Hepatic
Look
vein.
for your hepatic vein.
Hepatic vein.
That's how you're going to put it together to remember this thing. What brings it in? What takes it out?
Hepatic
Not just
portal.
what bring it in, and then you don't know what happens, where it goes and what happens. So what does the hepatic vein does? There you go. So everything, it don't carry the low oxygen, but it's carrying all the detoxified stuff back to the heart, so the heart can put it into what? The systemic
Circulation.
Because now it don't have the poisons inside that can create problems in the body. Take your time, get this right. Because when you understand this with the cirrhosis and the portal hypertension, you'll fully understand the encephalopathy. You're going to understand why some patients look the way they look. That is with jaundice or what's going on in the
Yes.
patient. Confusion and all the nice stuff, you'll understand.
Because of the bile.
But just understand
All
how,
the yellow thing gonna be in your eyes.
what is called the physiology of it.
Because of the bile.
Okay?
Yes.
So whatever you eat, gotta pass through your liver. Let's put it that way. Whatever go through your mouth, whatever go through your mouth, gotta go through your liver. So if you're drinking a lot of stuff, you know sometimes you drink stuff and you take some medications and it changes the color of your stool, right? You can also change the color of your urine. Sometimes you drink something that's really yellow. See your urine come out yellow too, right? You don't have jaundice, but it's based on what you drank. But seeing that when you have problems with the liver, you end up with jaundice too, right? Jaundice is very much evident. Why do you think when you have problems with the liver that you can get problems with jaundice? Possibly, not all cases. And what cases you think can cause, that's related to the liver, that can cause jaundice?
Because of the bile.
Because of what?
The bile.
Absolutely, bile, definitely. And what about the bile? Where is the bile coming from?
From the liver.
The bile is coming from the liver, right?
And then it's stored in the gallbladder.
And it is stored in there?
Gallbladder.
Absolutely,
And
So but how it makes the skin yellow now?
no, because you can't secrete it, the bile to do it's detox. That's why it's toxic, not detox. It's toxic because the liver not doing the good job. That's why it's going all over the body now.
She said because the liver is not doing a good job. That's why it's going on with the body. And why is the liver not doing a good job?
Because you might be having cirrhosis or fibrosis.
Because you may be having cirrhosis of the liver. Okay. That's one rationale. Not bad. Give me something else.
Alcohol.
Well, alcohol can be a contributing factor.
Infection.
Do you guys know when the persons get jaundice?
Yes.
Why do you get jaundice?
Jaundice because
Gallbladder what?
Cancer.
Gallbladder cancer.
for some babies want jaundice. Is that because
What I'm hearing you guys saying, I said babies are born with jaundice, right? And when we talked about it, we called yellowing or the yellow babies.
Yeah.
We had stated at that time was the mere fact that, and it's still with me now, okay? When you have massive breakdown of your red blood cell, it causes something called what? Bilirubin. And that is due to the massive breakdown of the erythrocytes. And what's in the erythrocytes? Hemoglobin. And what the hemoglobin contain?
Red blood cell.
Lots of iron. Now look for bilirubin. Look it up, please.
Bilirubin.
Because it's different in the sense of when you are having a yellow baby, in the sense that
Bilirubin.
it's a mother, and if you guys remember what we did, we talked about RH, negative mother getting an RH, positive baby, right? And we stated at that time that when the mother, the first baby, is come out normal. But the second baby will be yellow because the mother develops what? Those antibodies. That's one form. We talk about sickle cell anemia. Massive breakdown of the sickle cells, the erythrocytes. Bilirubin. What, did anybody find it? Somebody read from the
Can't
mind?
pronounce it right. Bilirubinemia. I got it.
That's in the bile.
Presence of bilirubin in the blood. Presence of bilirubin in the blood.
Excessive buildup.
Bilirubinemia.
Cause. Go for cause now. Bilirubinemia. Like bilirubin or your bilirubin? Put the anemia behind it.
Anemia behind
Anemia. Anyway, you have an excessive buildup of what?
Bilirubin in the blood.
What causes excessive buildup?
Concentration of bilirubin in our bloodstream is abnormally elevated. This is hyperbilirubinemia.
Right. We know that's a high, right? But what causes it? That's pretty
The body, I don't know, the body normally produces red blood cells every 120 days.
Liver and gallbladder disease.
Second.
Liver and gallbladder disease.
Right, liver and gallbladder disease, but you also find it with a massive breakdown. You get in the stuff, right? I want you to just go with cause, because you have different types of jaundice. Remember, jaundice is not a what? A disease. It is a what? A sign or a manifestation of a disease. So we could be talking about the liver disease, and the person have what? Jaundice. We could be talking about a person, a baby born to a mother who's RH negative. Baby will have what? The yellow discoloration. We talk about persons who have a genetic problem, sickle cell disease, massive breakdown by the spleen. Jaundice.
Yes.
It's just how today you learn that it's not only going to the bathroom and straining for constipation that can cause hemorrhoids. You learn that a person who has portal hypertension can also cause it. We know that a person who, or you've learned that a person who could have mental issues
Yes.
if they're alcoholics. And lots of time it's not because they want to trick you or something, it's because they have that corticals. They're having this memory lapse and they're just trying to fill in something just to get by. And they talk stupid stuff because you don't know, and especially if you know what they're talking about, it sounds real crazy to you. But they're just trying to fill in gaps in their memory. Now, originally, my question to you was, why do they do the tips? What was the reason for that? Right? That was the original question, exactly. So why do they do the tips? Why should they do the tips? You said because of their varices, the bleeding. If it bypasses that and stop that portal hypertension,
Decreases
it's going to what?
decreases the
Stop their pressure to
Yeah.
cause the varices, right?
Yeah.
And the bleeding.
portal hypertension.
What it causes is that now the blood is not what? Detoxified. And it put the patient at risk now for problems related to things that's in the bloodstream that's not supposed to be. Things that's supposed to be taken out by the liver is not taken out by the liver. So do you think it's good to eat liver?
Yes. Yes.
Because you don't like it.
Because
After this conversation, do you think you should be, discussion, sorry, you should be eating liver?
Yes.
Not from a human being, from an animal.
It's the same.
I'm saying something.
You hate liver?
I love it.
Liver
should not be
eaten.
You gotta prepare by the right person.
Everything inside.
You gotta get prepared by the right person, you'll love
Try
it.
liver,
Trust me.
try.
I love liver, man.
That's doo-doo.
They're clean.
That's
Clean
doo-doo
enough,
now.
you try them.
I can't clean it enough.
You gotta know it.
Not me. Nothing inside.
Based on these questions I asked, I realized that you guys didn't do a lot of reading at home on this liver. Guys, the liver plays it's one of the most important organs in the body. All organs in your body are important. But when you can live with only one what?
Liver.
Kidneys that is not working properly, you go get dialysis, right? But when your liver gone,
You're done. That's it.
and then all the things that people go through. Belly swell up big, crazy, talking nonsense. Hepatitis. Please read up on hepatitis. I give you like 4 of those things to read up before.
Hepatitis.
I give
You
you guys
give
things to
us
read up on. Related to the liver.
hepatic portal hypertension.
Hepatic encephalopathy.
Yeah.
The liver is affecting the nervous system. Right, you see the connection? Now, remember, when people think of the brain and the central nervous system, you just think about it, the musculoskeletal and the brain controlling movement and that sort of stuff.
This one has ammonia in the urine
But you have also to think about
and the liver.
disease and disease processes and how it affects the brain. How the person thinks.
And cold.
Cold. Alright.
For a moment, just relax. I'm going to give you your papers and you give it to me back. And you look at it yourself. And
One and then you shouldn't put 25. You should have put 24. Because it was 24%. He asked me. So, why do you put 25 questions when it was 25? Put 25.
I will put 5
Oh, so, yeah. English is sophisticated. Sophisticated English. If I knew what he was saying over there, you know?
Good one.
Man.
Nice try. I'll help you next time.
Okay.
Guys, let me just say something related to assignments. Some persons are really plagiarizing. I've been taking a lot of times and I feel like I'm just wasting my time because it takes me hours, not an hour, hours, to just read what people have written and then to see two persons have exactly the same thing and it's exactly wrong. It's just mind-boggling. It's crazy. Why people do? It's really, I don't know. You know, it's really.
I got this right. I got this right, but I put it wrong. I got this right as A, D, and E. I got that right. So I got that. They put wrong. I got the passing score. I barely made it.
I got one right.
Man, that was a difficult test.
What about 23?
Number 7, IKEA. Give me a second. Let me see. Number 7.
It was
Assessment. No, it's assessment.
One and then first.
You have it?
Second, no, second.
It gives you some.
I got it on the, look at WhatsApp, I already sent it. What are you doing? You're making it too hot, you're making it too hot. Look, it's already there, look at that. You're making it too hot in this class. Somebody just marked the wrong answer for me. Just to spite me. Out of spite.
After you work so hard.
Out of spite.
I say English not that bad.
My English is... you see, that's futuristic grammar.
It's not that bad, right?
Oh my goodness. You gotta read the questions really closely. But you know, he pressured us with the time. The time pressure was crazy. I'm telling you, my sister. I'm telling you.
Did you find it?
What was 24? What was 24?
Right.
What was 24?
Just 24.
The answer?
Yeah.
I didn't know it was you.
It was B. It was B. I got that wrong.
Yeah.
Okay, I still manage. I'm a manager. I manage.
D minus is not a pass.
I know.
That's tough.
I still get my license, right? I still get my license, right? Okay.
D minus is not a
As long as I got my license, that's what that matters to me.
Get the E for effort.
I got my license. That's what matters to me.
Get E for effort.
Oh Lord.
Get E for effort.
Oh man.
back up with this too.
It's cold? That's a C? That's a what?
That's 65 C minus.
What's a D? Okay. I will challenge him. You going?
Yes,
Why?
I have to pick up my son.
Alright. I'll see you tomorrow. Drive safely. I love your hair. I love it, yeah. How long you had it? I'm just seeing it for the first time. You know why? Because I'm trying to get a new hairstyle for my lady because her birthday's coming. I'm trying to get a new hairstyle for my lady. Her birthday's coming. So I'm going all out.
When is your birthday? This month?
Next month. Going to the Virgin Islands.
Really?
I'm thinking of it. Because the cost is still very expensive.
You've been here
All right, guys, let's
First time.
separate. The last couple of days, I've just been going through all of the assignments and what persons have been giving them to me. So I can basically do a breakdown and analysis of what you're doing, so you can have more of an individual evaluation of each persons, not just on your performances and attendances and that sort of stuff, but your whole approach and how it is reflected in what you're doing. Like, for instance, when persons wrote, right, why do you want to be a nurse? And then what persons wrote related to different assignments I give you in classroom, and I looked at certain things. When I say approach, that person's picking up piece of scrap, tearing it and writing and pass it on. So I keep all of those so that you can look and see where you're moving from to where you're going. And because there's a saying, those who forget the past are condemned to repeat it. So you want to ensure that the things that you did in the past, especially in the classroom, and the way you did respond to basic things that you should do, like when we do your assignments, or you ask questions in the classroom, you say write out something, and your approach, you look at it. How people, if they're organized or not. Some persons have done quite a lot of work. And I can see the persons have put a lot into what they've done. There's sometimes writing it in the right format may not be always what it should be, but I can see the effort that was there. Then I see where persons did not understand, totally did not understand, and did not ask questions. They just let it go and just come and continue without trying to make clarifications of things that they don't understand. I look and I read some stuff and I was like, what the hell is this? Why don't they just say, I don't understand? Let's clarify it right there and then. Instead, just let it go on. And when you write something, remember, writing is what? Documenting. Documentation is legal, right? Hearsay is not. So when you write something, it means that you put thoughts into action. And if you wrote it and during the time of talking you find that it wasn't right, say something, say something. Say something. I'll be meeting each one of you before you get out of this class, the program. And hopefully we can go over some of those areas that you really need to look at. Really need to put yourself together in these areas. I know that persons may have challenges, and I purposely avoid the word problems. Because in life we have challenges, not problems. Because we have ways we must look to solve it, because it's there, and we have to move on. But you're coming to these classes here, and you're coming to these classes to learn. And if there are obstacles in your way to learning, please stay so we can eliminate those obstacles. There's no stupid questions. Regardless how you may think, the person may say that's stupid. It is not. Ask questions. Don't just sit to the back there, and then when I look at these assignments, I see you did not get a concept. You just sit there and then do the assignment. That's why we ask for assignments. So you can see how you're thinking, how you're putting things together. Yeah, of course, we have persons who are very good. Good at plagiarizing. Copy and paste, Lord have mercy. Copy, drop it in there, you got it. No, you got to read it, understand it, then put it in your own words. This little test you did today was basically to see how you assimilate information, if you understand what is to be subjective and objective, how you put it into the nursing, this nursing process in place. One of the very first classes you get this nursing process. Because why? You have to apply it to everything that you do. Everything. But because this is such an intensive program, one year, you need to step up a little faster. You don't have the luxury of. Well, what I can tell you is that after you finish the 1 year here, you have some time before you actually go to the state boards. I would advise you, I would strongly advise you, do not just wait until you get the okay to go to the state board before you start to do reviews. I would strongly advise that you start review, or not start, you continue. And if you have not been doing reviews at home right now, start doing it. Because when the time comes for the state board, you don't want to run and do a 3-day review class. It's not going to be good. You put a lot of pressure on yourself. Take the time and go over it. You get it wrong while you're home, you get it wrong, that's all right. But don't go to a 3-day review class and then run and think you're going to.
Check your
Get
messages.
yourself together, and then when you get the date of your exams, the week before, review class. Wherever you got a review class, go to it. And that will be your success. But don't do what you're doing now, what a lot of you are doing right now. Don't even prepare for when you're coming to classes. You're paying a lot of money. You're paying a whole lot of money. I wish I had that money you guys have. I gotta be going. Me? No, I don't have that type of money. I wish I had that money. Huh?
You got it easier than us.
I do, in what sense? Now with money. You guys got money, man. Why do you think I haven't gone and fly down to other states and work for what? $10,000 and $11,000 a week. I don't better for that. As long as I survive and I live happy and I'm okay, I'm good. Right there, sorry. Life is too short. You gotta leave this earth. Whether you like it or not, you gotta leave this earth. You better enjoy yourself.
So consistent.
Anyway, happiness is a state of mind.
Alright.
And you're not gonna be happy if you do not pass your exam. Okay? Don't care however you put it. If you do not pass your exams, you're not gonna be happy. You have a lot of time. Make use of that time that you have. And I'm going to say it again, do not follow anybody. Make up your own schedule. Do not follow anybody. Because most times when a person is learning something, they're learning what they want to know, not necessarily what you need to know. So you're going to end up following what they're doing for themselves and not what you should be doing for yourself. Groups are not bad, but it should be within a learning environment.